50 million people in the US are without health insurance, but the ones who do have insurance are sick of it. Many students have issues with injury in transportation, vaccines, and even doctor's notes for class.
Oftentimes students would come, just because they needed to be out of class for the sniffles or something. It was a waste of their time and they were feigning illness. If a student comes in who has a prolonged illness of some kind, we often will do a note, saying that this person should not be in class for X amount of days or whatever.
Don't break a leg. Finding transportation to a hospital is up to the student, and White Plains Hospital registered nurse agrees.
No, I don't think so. I think that people really have to be responsible for themselves, and I think that in the event that you didn't have any means to get to the hospital, you didn't have a friend, you didn't have a family member close by, there's always taxis. You live in an area where taxis are available. I'm not sure that should be a service that the school should provide.
She spoke of health insurance and who doesn't have it.
Some people come in self-pay, but most people will have some type of health plan that's sponsored through government agency. Probably the people that don't have insurance at all. The young people can qualify through a state program, and older people are cared for through Medicare. So it's probably people in the 20, 30 range group that are the most people that don't have insurance.
Purchase student Shayaska Gonzalez had more to be in agony over than her broken leg this past year. On crutches and off one foot, Shayaska was out of options.
I don't have the money to buy an actual wheelchair. I just need one till at least the end of the semester. They told me no. They checked. It took 5 minutes to check, and they checked and said, "Oh no, we don't have any extra ones. Sorry, it doesn't go through. You don't even have the health insurance for the college."
According to Gonzalez, in order to get better, you better have the cash, and that's not including Purchase's health insurance.
I said yes to the strep throat test, thinking that it would be inside my my health should cover, my health insurance should cover, since I had the school health insurance. Finished doing the strep throat test and we're waiting for the results, and she goes, "Oh, and by the way, you're gonna be charged $15. I'm like, "Are you kidding me?" She goes, "No, it's not covered."
Patient of White Plains Hospital, Joyce Paulos, has many issues with healthcare herself and doesn't feel her cases are that extreme.
The waiting game. It's a big waiting game. It's costly. I have Blue Cross Blue Shield. It's always $300 and something, which is way out of pocket. It's always way out of pocket. It's always costly. My girlfriend fainted 2 weeks ago. She had to wait more than 7 minutes. She fainted. It was, and we waited so long for the paramedics. It was such a delay. I think the healthcare system sucks.
These issues of healthcare that students and Americans will face will have the people's lens focused on the 2012 elections. With Catherine Castro and Aurora Folks, I'm Isaac Feldman.